So I'm going to be doing my presentation on social deviance and labeling of the mentally ill. And my name is Maria. What does mental illness mean to me? Being mentally ill to me means that people are those that cannot function on their own. They cannot think properly. Random explosive behaviors, suicidal thoughts, mood swings, and the clinical term is clinically significant behavior or psychological syndrome or pattern that occurs in an individual and that is associated with present distress and disability or with a significantly increased risk of suffering, death, pain, disability, or an important loss to freedom. And the quote is based on the reading Illness, Mental Health Stigma by Briank Ahemdani. And limitations. They're unable to speak for themselves and causes for the hardship or having the help of a caregiver, meaning that they can't help themselves, and in many cases the caregiver has to do everything, and they have to have legal representations, meaning that they have to have help from others, all day care, meaning that because of their health problems they have to have help. They have to have help from others, physical help, like helping them clean themselves, feeding themselves, and sometimes helping them to cope with what their illnesses. And in many cases they're unable to have stable jobs because of how hard it is to control their emotions. They can have bipolar syndrome, where they can be happy one time and sad the other, angry most times, and they just can't keep a stable job because they're mentally ill. Mental illness defined by society. I believe that for many people, they define it as wasting money, because if they have a mental illness, they're never gonna fully recuperate from their problems. They're just gonna be treating it day by day. Sometimes it's a burden to society, because in most times the people with mental illness, since they don't know how to handle their distresses, or they're basically unable to function by themselves or work, they become a burden to society, because they sometimes become homeless. They basically stay on the streets, talking to themselves, and people just pass by and they look down upon them, because they should be receiving help instead of being on the streets. And another is that they're unable to care for themselves, so people have to take care of them, just like the elderly, like children. They need help that many can't provide. What are the factors that cause mental illness? They need a proper diagnosis from a doctor, and if they're not properly diagnosed, they can have the treatment that they need. Constellation of signs and symptoms. They're just symptoms that are piled up amongst each other. It can be social factors. It could be trauma that they've had in the past, other distresses that they would have had, and it's also genetic, where it runs in the family, and biological, where abnormal balances in their brain would happen. Like I said, in environmental stressors that can happen. It can be psychological trauma incidents I've had that had happened in the past. And how are labels defined and maintained for the mentally ill? The labels that they have is that they're crazy, meaning that there's only that factor that they're only crazy. It's not that they're bipolar. It's not about that they have schizophrenia. It's not about if they have um, depression. It's just that they're basically defined as crazy. Um, Diagnostic inflation. It's harder to be diagnosed mentally healthy, and that's according to chapter 4. And a quote that happens to that I came across is that mental disorders is vague, ambiguous, and confusing term. Human behaviors, thoughts, and feelings are just too diverse health to be neatly separated into the two categories of sick of healthy, meaning that it's really easy to fake, and it's very hard to separate the sick from a healthy mind. And agnosia is unaware of illness, where a person doesn't really know that they have the illness, and they just live their life with an illness that they don't know about, and until the their elder years is when they find out that they have this um they're sick. And sometimes, like I said, that they're fake. It happens so that many people, to get out of a certain to get out of an issue, when they become incarcerated, that they kill someone, they try to play it off that they're sick, that they're mentally ill, and instead of going to jail, being incarcerated, they put them in a health institution where they just have to receive the treatment and be in the institution rather than being in a jail. And this fulfills my PowerPoint. Thank you.